Good morning. Welcome to Your Health at Alivio Medical Center. My name is Dr. Joseph Smedley, and I'm a licensed psychotherapist. And one of the challenges that I'm finding with our patient population, particularly as it relates to their children and youth, is this whole concept of internet and technology addiction. When we think of addiction, we usually think of addiction to some kind of chemical, such as a drug, alcohol, but there's something called behavioral addiction. Behavioral addiction is an example would be gambling addiction. As many of us know, people become addicted to gambling. There's even a Gamblers Anonymous. However, we also are beginning to find out that people can become addicted to technology, cell phone, internet, and gaming. And one of the challenges is that many of our patients have children, and sometimes the patient himself or herself are addicted to a technology, gaming, internet, and so forth. So the recommendation we find is that research has shown that children between the ages of 8 and 18 spend up to 7 hours a day in front of some kind of a screen, either at school or at home. And what that suggests is that since we are human beings and we're designed to communicate one-on-one to each other, that more time is being spent in front of some kind of a screen than actually communicating one-on-one. And what we don't know is what is the impact of children who grow up spending more time interacting with screens than interacting interpersonally. We don't know what the results of that are going to be cognitively with regards to young people when they're in college and adults. Some research is starting to emerge, but we really don't have the total answers yet. So what we recommend is that parents of children who have technology, that, for example, the American Association for Pediatric Psychiatry recommends that no child be exposed to a screen before 2, because before age 2, children have a very difficult time distinguishing reality from non-reality. After 2 and in the early childhood, it's okay for you to begin to introduce technology, but they should be monitored. Parents should monitor their children and their use of their technology, particularly as it relates to technology in the bedroom. Children should not have TVs, laptops, cell phones unmonitored in their bedroom. Ideally, you want to have it outside in an area that is easily accessible to everybody in the house. The other thing is that the white light that emanates from laptops and cell phones interrupts with sleep patterns. So it's more difficult for children to get to sleep if they've been allowed to continually watch games or interact on the cell phones prior to going to bed. So the recommendation that I make is that children be monitored relative to their cell phone and technology use. It's more difficult now because schools are providing iPads and laptops to the children, and then they come home and they have additional screens that they watch as well. So the recommendation is that we monitor the children's use at home and make sure that technology is placed in an area that is accessible by everyone.